Welcome. Good afternoon. We're talking the backdrop of over the last 2 years or so, the sweeping changes being brought about across businesses. Today, we're going to be talking about changes in the healthcare sector in the post pandemic world. Welcome to the Economic Times Leadership Dialogues on Workplace Transformation presented by Google Workspace. When the winds of change blow, some people build walls, others build windmills. It's an old Chinese proverb, but paradoxically, as some believe in today's world, China is where the roots of the current global healthcare crisis lies. That's a separate discussion. But the Chinese saying does remind us that when a crisis strikes, it presents choices too. Those choices, in turn, shape organizations and their future. So, the scientific progress, technology disruptions, and innovations in clinical practices, and innovations of a whole variety that has tremendous potential to improve patient lives and create value for companies and entire stakeholders. It's not proving to be easy to realize that potential if we can collaborate and work together, aided by technology in today's world. It needs to be remembered that healthcare has remained untouched, even as e commerce, possibly telecom, banking, and some other sectors or industries have been disrupted because the spread of the internet and democratization, if I may use that word, of technology and the access to some systems as well. So, to explain the opportunity, the challenges, and some of the context as we look to discuss about the transformation of companies and workplace transformation for companies in the healthcare space, we have some very important people who you'll get to hear. Dr. H. Sudarshan Balal, who is Chairman Manipal Hospitals. Dr. K. Hari Prasad, President Apollo Group for Hospitals. Mr. Viren Shetty, Executive Director and Group COO at Narayana Health. Mr. Ramasubramani Ganeshan, he's CTO at Portea Medical. Dr. Utkar Shah, Director at KPMG in India. And Ms. Dragana Biara, APAC Head of Customer Engineering at Google Workspace. Welcome everyone to this conversation. Over the next 90 minutes, we'll be hearing all of you and we look forward to that. But I'd like to remind everyone watching us that you can also ask your questions to, and we'll try and direct them to the experts, to one of the speakers, and I will request them to answer your questions, and I'll do that on your behalf. Let's begin, but for the changes that are being unleashed, let me ask Dr. Utkarsh Shah, Director at KPMG in India, to paint the picture for the entire landscape before us. Utkarsh, it's all yours now.
Thank you, Ashutosh, and thank you to Economic Times and Google Workspaces for giving me this opportunity. I think a very pertinent topic today on the healthcare workforce and how healthcare workforce has transformed over the years. Last couple of years have been challenging for us. And as we have tried to navigate through these challenges, there have been a lot of new learnings. Organizations have picked up new ideas, new innovations. But one key takeaway that has come across as a part of this COVID pandemic has been that no healthcare system in the world is ideal. All healthcare systems have been exposed as a part of the pandemic in terms of the obvious deficiencies that they have. Some of the deficiencies are related to infrastructure, shortages of beds. The other deficiencies are around supply chain and availability of essential medicines. And then there are the obvious deficiencies of human resources. And as the world continues to grapple with this challenge, I think what we need to understand is what a strong, ideal, and a resilient healthcare system requires to have. If we go by what WHO calls building blocks, there are three fundamental pillars to any healthcare system, right? The first is service delivery. Service delivery, which is the ability of a healthcare system to be able to cater to the healthcare needs of the population, appropriate and timely healthcare requirements. The second is healthcare financing, which is essentially the ability of a healthcare system to be able to cater to the healthcare needs of the population, irrespective of their ability to pay. And the third, and probably one of the most important factors which influences the other two, is the healthcare workforce. The capability, the skill set, the talent that a healthcare system has in being able to deliver right set of care and at the right price. If we think about healthcare systems in general and try to understand the healthcare workforce scenario, there are 3 points that come to our mind. The first fundamental point is the obvious abysmal shortage of healthcare resources. And when I say shortage of healthcare resources is across the board, across cadres, across levels of specialization. We talk a lot about doctors always when we talk about healthcare. Let me probably quote some statistics around nurses, which are very important components of the healthcare delivery system. India currently has about 1.5 nurses per thousand population. Now, if we were to compare these numbers with other BRICS countries like Mexico, for example, Mexico has double the numbers, 3 nurses per thousand population. Brazil has 3.5 nurses per thousand population. China has 3.5 nurses per thousand population. So, and I'm not talking about the developed economies. I'm not talking about United States. I'm not talking about UK. We are, when we compare ourselves with BRICS nation, clearly in shortage of a very important cadre like nurses. And mind you, countries like US and UK are still grappling with issues around medical errors, issues around hospital infections, despite having these high number of nurses. So I think one of the fundamental agenda point for discussion today is going to be this human resource shortage. Right? And what is it that we can do to solve for this human resource shortage? The second point which comes to my mind when we talk about healthcare workforce is the skilling and the training, the medical education skilling and training. We have in recent times seen a lot of regulatory changes that have happened within the healthcare system. There has been a National Medical Council that has actually changed the guidelines for setting up medical colleges. They have trimmed down certain guidelines in terms of requirements for the number of hospital beds, training hospital beds, or their guideline requirements for the kind of infrastructure that is required, right? And all of this has been designed with the intention of solving for this large gap that we face. As per a very recent ministry report, over the last 6 years, undergraduate admissions within MBBS has increased by almost 55%, and postgraduate admissions in allopathic medicine have increased by 80%. And these are heartening numbers, right? These are encouraging numbers in that sense. But having said that, one of the major limitations when you talk about medical education, and one of the major limitations or the challenge that we talk about is the requirement for creation of these large edifices, large institutions which have high capex requirements. And therefore, I think the second question of today's discussion will largely be around what is it that we can do to bring, without compromising on the quality of medical education, think about how we can create a more efficient and a more cheaper education system. Again, mind you, without compromising on the quality of education that we offer, because for everyone here, MBBS undergraduate admission, MBBS undergraduate admission is probably one of the most expensive programs in the country. So what can we do actually to probably bring down the cost and therefore make medical education more accessible in that sense? And the third, obviously, is technology. Technology is ubiquitous. Everyone and all pervasive. Healthcare has continued to be influenced by technology. We have digital health solutions that have come in the fore, which actually help in diagnosis and treatment. We have remote monitoring solutions, which have actually helped in ongoing patient management. We have AI and clinical decision support systems, which actually help clinicians in terms of determining the course of treatment and diagnosis and so on. So technology has, in a lot of ways, actually helped make healthcare more efficient. But what is the role of technology when we talk about workforce? How does technology or what is the kind of training that our workforce today requires from the context of the changing technological backdrop that we are seeing, and what are the challenges that organizations typically face when they introduce new technological solutions and introduce new technological variations into their routine, right? And what are the kind of challenges and capabilities that they need to train their staff on? So I think these are the three major agenda points that we intend to discuss today. And I will hand over the mic now to Ashutosh and my co-panelists to carry on the discussion further.
Okay, thank you so much for that, Utkarsh. And let me take the first question to Dr. Balal. Dr. Balal, over 1 billion people, mm, if I may say so, a creaking healthcare system, stretched definitely. How can tech and a collaborative approach to addressing the healthcare challenge help change the face of healthcare in India? Ultimately, technology is allowing us to redefine the workplace as well. Dr. Balal.
Good evening, Ashu, and at the outset, a big thank you for hosting this wonderful seminar. It's great to be among such eminent panelists. As you rightly said, uh, the clouds of corona brought in the silver lining of the use of technology in medicine. To me, that was one of the greatest boons. We were sort of entangled in a quagmire of legal and regulatory issues, and for years, maybe decades together, there was no digital health available for the doctors because we didn't know what was the right thing to do. And believe it or not, within a week, in the last week of March 2020, everything changed. Digital health became a reality, and now it is something that is used all over the country to great effect. And I think this is the solution for the future, because there's no way we're going to bridge the gap. We keep talking about shortage of manpower, shortage of infrastructure, but what we don't talk about is also the inequitable distribution of healthcare facilities and workers. Just to give you an example, we have huge shortage of cardiologists across the country, but if you look at the DM seats and the DNB seats in cardiology in Bangalore alone, about 50% of them are not taken, which means it's not just shortage of doctors, it's inequitable distribution of healthcare. And this again can only be bridged if we bring in technology, because it would be impossible for a cardiologist or any specialist for the time being to settle in a village or in a rural area, because the infrastructure doesn't permit him to use his expertise in that area. And for that, we need technology, not only to bridge the gap between what's happening in the rural and urban areas, but also between the private sector and the government sector, because unfortunately in our country, 70% or more of tertiary care is in the private sector, and less than 30% is in the government sector. And unfortunately, even today, the private sector is deemed to be expensive for the common man. Again, here, technology can help us in doing what we could do. I want to give you a simple example of what happened in my life. I'm not tech savvy. I mean, I've sort of started learning technology the way it is now. And once COVID came in, I couldn't see patients face to face because they couldn't travel. I couldn't come to the office for various reasons. And then one day I started doing telemedicine and teleconsults. And to my surprise, a patient that I had not seen for about 5 years came in as a teleconsult. And this gentleman was in one of the remote parts of the country and normally would take 48 to 72 hours to come to Bangalore to see me. And there he was sitting on a charpoy. Believe it or not, I saw some movement behind him. I was wondering, what is this movement behind him? And then I saw a four-legged animal behind him. He was sitting in a cow shed, and his granddaughter was helping him with the iPad. And I was able to talk to him, and he was able to talk to me, and he was all smiles because he could talk to me. I could sort of find out what's wrong with him, and we could even tell him what was the need that he needs to take care of. And he didn't have to come to Bangalore, 48 hours of journey by train, bus, so on and so forth. And this is the power of technology. And what I really believe is that we need to move away from brick and mortar hospitals to home care, outpatient care, day care, and the hospital should be reserved only for the very, very sick. and people need procedures. And this can only happen if we use technology wisely. Of course, there are a lot of things that may not be the greatest in technology. Of course, one issue which I'm sure people will talk about is the confidentiality issues, making sure we maintain patient confidentiality. The other thing which is very close to my heart is that I think the patient doctor, sacred patient doctor relationship may not be the very same unless you feel, touch, and smile in person to the patient.
Yeah, very interesting points that you mentioned, Dr. Balal. So we'll come back to some of those issues, but let me go across to Dr. Hari Prasad and ask him, because Dr. Balal, you referred to the inequitable distribution of healthcare facilities. So, Dr. Prasad, since Apollo has been a pioneer in healthcare services across the country, how has technology changed the healthcare for you? And what Dr. Balal is suggesting now, could it have been thought of maybe 2 years ago or before the pandemic in such a sweeping way? You're on mute, Dr. Prasad, so possibly an evening.
Sorry. Good evening to all the distinguished panelists, and thank you for having me here. To begin with, I think COVID has changed a lot of things, almost in every sector, and the same thing has happened in healthcare. So it needed a COVID for the transformation to set in. At Apollo, we are very, very passionate about one acronym called ACE, which is the Apollo Clinical Excellence model. That's the dashboard that we have. So I will explain this in the same with the same acronym, ACE. A standing for access. I guess India is a huge geographical expanse with islands of excellence. These islands of excellence are concentrated healthcare facilities in places like Bangalore or the metros of Hyderabad, Delhi, and Chennai, while a huge part of the country where a major section of the population lives is still underserved. So it is a huge geographical expanse, and geographical access is one thing which was a huge challenge. But as Dr. Balal just explained, technology is bridging these gaps, whether it's in the form of teleconsults, and it's gone beyond that. Now, we talked about shortage of human resources. Apart from cardiologists, I think COVID actually threw up a challenge in terms of the shortage of emergency physicians and intensivists. We don't have enough intensivists to serve even 1/10 of our population. We don't have enough emergency physicians to serve even 1/20th of our population. So that's where an EICU came into place, where an intensivist sitting in a metro far away from as a tier 2 or a tier 3 city could actually provide services to a sick patient in a ICU in a distant location. Similarly, e-emergency, then telepathology, teleradiology, all these have made their entry into the system, and I think they're here to stay, and they are the solution that a country like India needs with the expanse in terms of the geography. And then there are newer models which we just worked with the government in terms of the drones, actual supply of medication, supply of vaccination. And these are all challenges when it comes to an emergency, or it requires a specific mode of transportation, specific temperature of transportation. So we actually use drones to transport vaccines to distant locations. And so there are plenty of new technology which is being used. And I think it is here to stay. And COVID has actually propelled us or transformed healthcare into the digital era. The C part of it is the communication part of it. Now, Dr. Google has made a huge difference. And I guess Dr. Google is much more busy than all the doctors in the world put together, because the first place they go to is the Google to anywhere, and then they come to a doctor physically or digitally through a teleconsult. So I think the sort of conversation between a doctor and a patient has changed significantly, whether it is a physical conversation or whether it's a digital conversation. Because the doctor knows at the back of his mind that this guy would have gone to the net and actually searched and he's got some information, right or wrong is a different aspect of it, relevant or irrelevant is a different aspect of it. But he's coming to the table with some information, and what could this be information? This information be is always at the back of the mind of the doctor, and the patient is actually looking at the doctor with an eye of suspicion, because he's not talking the same language as Dr. Google spoke for the right or reason or the wrong reason. So communication, the way the doctor is communicating, the need of communication has changed, and this has become a very important aspect of technology today. And second thing is, for some reason, I think the healthcare community as a whole and the sector as a whole was shy of communicating to the community, and not really communicating the right things. Therefore, you see that whenever a communication is happening, it is negative to the healthcare, not really what is happening in the healthcare sector, not really the bright part of it or the right part of it.
Mhm.
And although a lot has been said about the good work that's happened during the COVID, I don't think, I still feel that there's a lot of negativity which is spoken about the healthcare sector than the positivity, which should rightfully be spoken about the healthcare sector. So I think the healthcare sector needs to start communicating better with the community, needs to be proactive in its communication. And the last part of it is economics. ACE part of it is economics. The healthcare sector is today expected to deliver more for less. That is, there is a huge pressure on the tariff system. We're expected to bring down the costs, and the costs on the other side, that the input costs for us are going up significantly, whether it's the human resource costs, whether it's the technology costs, whether it's the consumable costs, all these are going up significantly. And we are supposed to deliver better quality of care. So this is a challenge which is coming in, and just a peek into the future. We are almost there, but just a few sentences about where we are headed for. I think I'll use the 5 P's for it. Preventive healthcare is going to play a major role for the future, and we've seen it during the COVID period, where the entire country was locked down just to prevent a person from getting infected for COVID. So I think more and more people are now getting into preventive healthcare, and rightfully so, because that is the best. No country will have the resources to treat the entire sickness that can happen in the country. So prevention is a very important part of any healthcare system, and India is no different. And India does not have the resources, as we already speaking about, to treat illness. So we must spend on the preventive part of it, which is going to reduce our healthcare costs. Second, there's going to be a lot more personalized care. We know today that we can go up to the genomic level of diagnosis, molecular level of diagnosis. So the same medication, same does not work for the same disease for two different people. So we're going to see more and more of personalization of care happening for the patients.
Sure.
And it's going to be more precise in terms of, let's say, cancer. You used to use the old traditional cobalt machine, which used to burn tissues all around the tumor, also along with the tumor. Today, we're getting into a situation where we have very precise treatment options with machines like the proton, which very accurately treat only the tumor part of it. And it's going to be more proactive. We're not going to wait and watch. Instead, we're going to, the physicians and the community are going to be more proactive about healthcare. And the last thing is about partnerships. And there are so many healthcare players sitting here, but I think unless there are partnerships, it's not enough. We've spoken enough about public-private partnerships, but we still do not have an ideal public-private partnership in healthcare sector. And the reason being, there's not, the 4th P is missing in the public-private partnership, which is the people. Unless people are involved in the public-private partnerships, it's not going to work. So the future of healthcare is heavily dependent on these partnerships. I'll stop here and.
Sure. So we'll come to the partnership. So a very important point that you mentioned, Dr. Prasad. But what caught my attention was a little bit about the economics that you spoke about, and one of the pioneers there, Viren Shetty, Mr. Shetty, give us a sense of the model that Narayan Health has been able to pioneer, and that has changed the workplace. It's been collaborative, if I may use that word, for the patients and on behalf of the healthcare service provider. How can that be taken to the masses driven by tech so that a larger part of the country can access such service at such amazing prices?
Thanks. We started our company with a very simple thesis, which is healthcare is expensive because it is done inefficiently, and our patients are paying the cost of our inefficiency. Now, to just give an example, it's not an exact example, but compare the difference between a hand-painted work of art from a single artist that you commission from them. And it comes at a certain price depending on what kind of artist you go to. Or compare something that's done through a screen printing. While both may be the same image, almost to the molecular level, you would not be able to tell the difference between the two. One comes to you at one price point, and the mass-produced one comes at another price point. They will both end up on your wall, and they both serve the same function in terms of whatever paintings do for a room. And healthcare is a bit like that. Because we haven't invested enough in standardization, because we allow a great degree of variance in how patients get treated from one doctor to another, because the treatment protocols are not standardized, and because we don't use a lot of the tools that allow us to do things more efficiently, healthcare ends up being more expensive for the patients. So to answer the second part of your question, which is how is it that digitization brings healthcare to the masses? It's simply the most effective way that humanity has so far learned how to standardize a process and make it run faster. And digitization is just the latest tool for that. Prior to that, there was industrialization. Prior to industrialization, there was standardization. Prior to that, I mean, going all the way back to when man first discovered the wheel as a faster way to move. We've always been pushing the boundary of what is possible and to make things better and safer. So as Dr. Balal and Dr. Hari Prasad had mentioned earlier, there is a huge variance in the availability of doctors because in India, hospitals can be built anywhere without requiring a certificate of need. What ends up happening is that there is a huge amount of crowding of medical colleges and doctors in large cities where people like to work, but not necessarily where most of the patients are. Meanwhile, in the small towns, in the villages, or even in the growing parts of a city where the patients may be a little poorer, you will find a relative lack of doctors. So this is distance. Distance is bridged through technology, exactly as we're doing now. We could have had this session with all of us meeting in Delhi, spending a whole day flying and having meetings and coming, or I could have taken just 90 minutes out of my day to sit in front of my iPad and do this. I prefer this vastly, and this is much more efficient, and I don't think I'll ever go back to traveling for seminars anymore. So behavior has been changed. Now, this has become the default norm. So we need to think about how, when patients have to talk to physicians, what sort of behaviors need to change, both on the patient side and on the physician side, to provide not the same thing. Now, obviously, there's a lot more value to meeting people, going face-to-face, getting a sense of who they are, and that is one kind of interaction. But if you're talking about the basic exchange of information, which is the foundation for most kinds of healthcare treatment, not a substitute for healthcare treatment, but a foundation, all of that can happen online. So patients should be able to give their lab reports to their doctor. They should be able to upload their symptoms to a place where multiple people can check on it. And that just becomes the starting point. I think the mistake a lot of us make is by assuming this is a substitute for the hard work that has to happen, which is we are a country that needs more doctors, we need more hospitals, we need more people that manufacture medical equipment and medicines. All of that is true, but it is also true that we have to invest in digitization and in telemedicine side by side so that we're able to do more with what we have. And in a resource-constrained environment like India, I would say it's even more important for hospitals of all kinds, not just private hospitals that can afford to pay Google and Cisco for all the licenses, but even for the smaller hospitals to adopt cheaper, freer tools to be able to reach out to their patients.
Okay, so we'll talk about the technology part of it as well, but Rama Ganesan, service delivery, and it's something that your company has excelled in. Give us the expanse for that and how you can raise the bar further now that as a brand, Protea is available in a large number of cities. I don't know the exact number, but how does that service delivery improve and you raise the bar maybe collaboratively and in the changed environment of today?
Thank you, Ashu. And thank you for the question and inviting me to this. Interesting to help improve patient to and we can think as the we can step forward. The that we were all wondering that how do we present it? How does it take forward the so I think quarantine so how is technology that fine I mean, stay at home but you need questions guidance are still agency so also started monitoring all the I think time to 12,000 in a day, both getting them for the first time, walking them through what the disease means to them, how they can themselves, family, of protocols they need to follow, plus even the follow-ups on the regular, typically is doing good, vitals, can them look good. Something doesn't look good, can I get a teleconsultation with you for better? So we need to have a doctor talking to every patient on a daily basis. I mean, how does that work? Protocols, right? Like even Severin was saying earlier, establishing the protocols, sure that this is the kind of data, the kind of flow that helps a lot in kind of compartmentalizing the work that can be the front line before the data flows to a doctor. So a doctor can now potentially have an influence and an impact on a lot more than if they do each individually. I mean, I'm sure if we go 100 years, right, how much was used front receptionist? I mean, but just that particular process, the brick and mortar, having someone who can do the stuff that a doctor doesn't can take that. Now expand that 10 times, 100 times, how technology can drive some of the more common aspects and let the doctors focus on much more kind of provide kind of, so the doctor can go with cake. The aspect is I think 100% of the time you are going to have challenges. You are going to have a slip here, some issue there, something got missed. Can we use technology to create the framework within which some structure around which the key things get covered? And beyond that comes the human aspect. I don't think we can ever diverse the human aspect from the patient and medical health. Critical for it. I think Dr. Ballal's view, even Hariprasad's view, you still need the connect between the patient and the doctor, physical connect. It's not going to go away with technology. But the right combination and the right structure, especially using our healthcare workers, providing the first layer, making sure that they are doing as per the recommendations from the doctor, which can be monitored, tracked, managed, and we know where there's a deviation. How do we track it and chase it down and correct it? Technology can help us with all these things. So I think it's actually a pretty exciting time to be in this particular domain. The kind of opportunity, the change that has occurred, that to me is one of the things, right? 2 years back, we with the doctor over video medium. There's always a thought process like, am I missing out something? But now I think that has gone away to a great deal. People are a lot more accepting of this as well. So it's the other side from our consumers. We need to be. I think this 2 years made that change as well. So I think buying to an awesome time to be drive change. And we still haven't spoken areas like AI can help or how more technologies can help bar on this.
Okay. Too many other issues. Imagine being teleported to a new environment. Well, two exciting times, I'd like to imagine. Dragon, I'd like to take the next question to you. So what should be the pillars? So we've heard from healthcare specialists and healthcare service providers. So what can be or what could be the pillars for a healthcare system or healthcare delivery that could be built upon, and maybe the options that some of these companies and more could have?
Wow, that's a big question. That there's, they say tech is easy, and it is. I think it's organization, it's the culture, it's the people that usually complicate things more than the tech itself. And it's really about understanding the landscape. And the landscape, especially in India, seems to be very diverse. So, I really like some of the points around extending healthcare outside of the hospital, enabling self-service to the patients as much as possible, and not really necessarily relying on Google search engine, but more like on the hospital and professional opinions that are certifiable. Looking at the workforce that's within the healthcare system, because doctors are not the only players there. It's probably the smallest group of all of the people who are contributing to the healthcare of the nation, and really looking at some of those different types of professions. So looking at enabling doctors in the hospitals, enabling doctors in private practice, enabling the collaboration between them and other entities they deal with, such as labs, such as research facilities, universities, their students. And then looking at the nurses and looking at the nursing assistants and people who are out in the field, who are going out to the remote parts of India where a lot of people that they come across might have not seen a doctor in a year or 2 or 3. And how do those healthcare workers who may not be fully certified nurses, how do they get an ability to engage with the rural audience that may not fully speak their language, that may not be able to even provide them with the basic information they're looking for? So all of those different personas play in the healthcare system. So if we're looking at the transformation of the workplace, looking at how they all operate and looking at how we can enhance their experience as the worker, as well as the experience of their patient, is really, I think, something that should be the driving force behind setting up that structure. So it is quite complex, but unifying the streamlining communication and collaboration is important. Streamlining the information that's shared is important. And of course, the sharing of information can be absolutely housed on a website. It can be assisted by chat bots. It can be assisted through, self-search based on specific questions that the patient is being asked, and then automatically triaged out to a specific healthcare expert. Because it doesn't have to be a doctor. It could be somebody with less robust knowledge, because whatever the inquiry is, it doesn't require full doctor attention. So looking at those channels and looking how to automate them and how to streamline them and looking at how to make them more secure, because of course privacy and regulation and data loss protection is really, really key in this industry. So moving away from paper and moving into digital actually can help. Because if we look at, for example, in Google Workspace, which is our communication and collaboration platform that we use within Google, but we also sell to our customers, we have very robust administrator controls, which can then be applied to pretty much every piece of communication, whether that's a chat, email, file, whether that's even a Google Meet, whether that person that wants to access something like that can access it. So security is another piece that's really important. So looking at from all of those aspects, how you want to address and what you're trying to transform is really key. And understanding again, what is your end vision and where you're beginning, and then figuring out step by step, because this is all an evolution. A lot of times people talk about digital transformation, but I prefer to use digital evolution, because as technology evolves and changes, as it'll pull us all along. And technology is really our servant. So it's really kind of up to us how we want to use it and to what extent we want to use it. And what's nice about, for example, Google Workspace is that it is a tool that masses are using. We have 3 billion users on Gmail, and it's something that anyone can use. So having also that accessibility to patients from anywhere who actually are familiar and comfortable sending an email, who are familiar and comfortable engaging in a video call with a doctor, who are familiar with searching various websites, who are familiar with uploading documents. So that's another thing, is a lot of times people are attaching files to email, which is highly insecure. So doing the direct upload to a drive, which is then shared within specific medical circle, can protect patient information and confidentiality. So there's so many interesting ways that these processes can be streamlined. And if you overlay that with a very rich ecosystem that we have in our workspace marketplace, then you can get a very unique offer that is very specific to your business and very specific to the processes and patients that you deal with.
Okay, that's the one of the opportunities that I'd like to think. Utkarsh, from, I referred to the changes being brought about in e-commerce and banking and the way it's being disrupted. Can you help identify, if with your lens, what areas of healthcare do you see being disrupted in a manner that it's easily accessible for a lot of people, and technology is, well, it's already making a change, that inroad of technology can be deeper and more impactful for people?
Sure. So, Ashutosh, I think these inroads are already made. If you look at healthcare and if you look at retail healthcare, you will see these transformations that have already impacted, for example, the diagnostic industry. We see a lot of technology being used on diagnostic industry to push for home collections, for example, right? Home collection is something that has probably currently contributes more than 20% of all the collections that most of the major diagnostic players do. The other space that has actually already transformed is the whole pharmacy distribution space, right? So India has this whole retail pharmacy play, and players like PharmEasy, players like MedLife, all of them have actually disrupted the space already. What has actually happened is because, and this whole game started with e-pharmacy as a play. E-pharmacy was actually conceptualized with the idea of solving for access and availability of critical supplies, right? Which would technically not be available in maybe remote parts of the country, right? Or if not remote parts, even in tier 2, tier 3 cities. E-pharmacies were able to expand into tier 2, tier 3 cities, making medicine available across. What they did was, on top of their customer base for e-pharmacies, they then built on diagnostics. They then built on consultations. So this whole play of retailization of healthcare, right? This whole segment of disruption that came in because of players like PharmEasy or because of players like MedLife is obvious, right? And is something that is one of the major areas of transformation. And because of COVID, what eventually ended up happening was a lot of hospitals, and we heard Dr. Hari Prasad and Dr. Bilal talk about it. A lot of hospitals started accepting the opportunity of e-consultation. Until then, hospitals were a little wary about e-consultations, primarily because of the fact that there were certain regulatory concerns around. And after COVID came in, these regulatory clouds were cleared, and therefore hospitals also ventured into that space. And which is why hospitals have also now started appreciating the importance of retail healthcare play, right? And they now compete not with other hospitals, but they actually now even compete with this whole set of digital players who actually offer e-consultations, right? They do not have physical infrastructures, and which is what Dr. Bilal was saying, right? We will eventually have to start thinking of not brick and mortar hospitals, but also start thinking of digital hospitals, right? Which do not have necessarily this whole physical infrastructure, but are able to, kind of to some extent, cater to this whole play of provision of care and improving access, especially in the remote areas. So as far as the disruption question is concerned, I think that disruption is already on way. We are seeing that about the emerging in the e-pharmacy play. We are seeing that emerge in the diagnostic segment, and now obviously the whole telemedicine play. And there are smaller pockets of this disruption also happening. Dr. Hari spoke about ICUs, right? This whole eICU concept is something where a doctor can be stationed remotely and an ICU can be operated in a rural hospital. You really don't need a doctor in that ICU, right? So these all disruptions are happening in the healthcare space.
Okay, so Dr. Bilal, since you referred to the hospitals which are more technology and they're not the brick and mortar hospitals, what kind of a structure could that have, and how, if you can give a broad, a sky high view, if I were to say, of such a healthcare service provider?
I think broadly, even though we are all in the healthcare and we depend on patients coming to hospitals to survive, I do believe that we should all work to keep patients away from hospitals. As much as possible, patients should be taken care of at home. Very rarely should they ever come to the hospital. They should be taken care at home. You can have home visits, as was mentioned by Rama earlier, where most of the things that you want to do in a hospital can be done at home, including a visit, vitals, labs, delivery of pharmacy, everything can be done at home. So they really don't need to come to the hospital. And if they do come to the hospital, make it an outpatient visit or a daycare visit. Do not keep them in the hospital for days together. I remember when my grandmother had a gallbladder surgery, she and the entire family were in the hospital for 4 weeks in the special ward, 1 room for her and 3 rooms for the relatives. So now the whole thing is probably going to be 24 hours in one single room. So I don't see why we should have a system that is so inefficient. If you can order biryani at home through Dunzo or Swiggy, why should you get Tylenol by standing in the pharmacy line for a few hours? So it just doesn't make sense. So I think we have to innovate, adapt, or we will perish. So in addition to the technology part of it, there are a few things I would like to bring in, Ashu, if you permit me.
Sure.
A few things dramatically changed in the COVID era for the better. Now, before the COVID era, of course, people used to rush to the hospital for everything. And even when the COVID era started, the government initially said everyone with COVID should be admitted to the hospital for quarantine. And within days, there were no hospital beds left in Bangalore. People who needed critical care were at home, and people who could just sit at home, watch TV, were in the hospitals. So that definitely changed. The second thing that changed, probably COVID is the only illness that I have seen in the last many decades of my practice where everything was equal. A poor man or a rich man could go to any hospital and get treatment. This was the beauty of universal health coverage, at least as far as COVID was concerned. Probably no other illness you could walk into a private hospital and get care other than COVID. And I think that should be developed upon, and the universal health coverage, which the governments are working on now, is something that should be the norm. And that can only happen if, as Dr. Hariprasad mentioned, the public, the private, and the government work together. It will not happen otherwise. And of course, we'll have to add insurance companies too. That certainly changed during the COVID era. And I think this is something that won't go back, because people now think that healthcare is their fundamental right, which it should be, and they should be able to get the care that they deserve. The other thing that changed is healthcare was relegated to the bins of history by successive governments since independence. This is the first time that I am aware healthcare has been given the importance it deserves, and probably the first budget where there's been a significant allocation for healthcare, because now we have realized the country is only as strong as its healthcare is. even the economy is only as strong as its healthcare sector is. So I think a lot of things have changed, and we should work on this, develop this, and make sure healthcare is a fundamental right for every citizen, be it technology, increased resources in the form of personnel, infrastructure, technology, artificial intelligence, and whatnot. And unless all of us work together, we will not be able to achieve this.
Okay, that's quite a task because even if in a country like India, for maybe 150 plus cities, large cities, uh, well, too many details to bother about. But let me ask Dr. Hari Prasad, since Dr. Balal referred to, and others also referred to, being taken care of at home. So is prevention better than cure? The old adage goes that way. Is that we are going back to that? How does the entire collaborative system of the public, of government, of policy, healthcare providers, how does that work in a system like that?
Well, prevention is always better than cure. Absolutely no doubt about it. It was and it will always be. And it's not only better for the individual, it is better for the community, it is better for the country, simply because it has got a socio-economic impact. It's not just a social impact, it's got a socio-economic impact. Prevention of disease is much cheaper than treating a disease after it occurs.
Mm-hmm.
Prevention is going to be a major thing which will make sure that our resources are better spent and are not wasted the way they're being wasted at this point of time.
Mm-hmm.
The second thing is, I think as we go into the future, we should look at a future where the number of hospital beds become irrelevant. And it's more of, as Dr. Balal just explained, more of digital health, more of teleconsults, keeping the patient at home. And you won't believe it. We treated more number of patients outside the hospital environment during the COVID second wave than within the hospital environment, almost 5 times more outside the hospital. And whether it was at a home or a hotel room, we treated 5 times more number of patients outside a hospital than in a hospital. So hospital beds need to become irrelevant with all the advances that are coming up. And this is only possible if we really look at prevention, early diagnosis, and very efficient management. The 4 P's which I talked about in terms of precision. And today, as Dr. Balal said, his grandmother was in the hospital for 10 days after a cholecystectomy. Even today, there are a lot of patients lying in the hospital after a knee replacement for a week or 10 days. But what we've really started doing is using robots, using technology. We've got into daycare knee replacement surgery where the patient comes in the morning and is off in the evening. And the rest of the thing is done at home, whether it's a physio or a rehab is done at home. I think the real challenge for the healthcare sector, provided it does take up, is to be able to make the beds irrelevant, make the care more relevant than the number of hospital beds that are available in the country.
Okay, so focus on the patients and his welfare, his care. The rest of the things can possibly fall in place. So there are questions coming in, and I'd like to take some of those questions. This is the first question, and Mr. Shetty, if I can come to you with this one. This is from a gentleman called Anantaram. He is from Dhanvantari Hospital Society, he says. Essentially, so this is what he's written. Essentially, how many of you would do with a teleconsult as a patient against a physical consult and evaluation? Yes, no doubt, medicine is technology driven. What percentage of population would benefit in rural scene or in urban scene? That's the question from Anantram. Mr. Shetty, if you can go for that.
Sure. It's a very good question. And like I said earlier, you cannot substitute a visit to a doctor, a visit to a hospital with a telemedicine consult. As I said earlier, it's the start to a relationship. So just to give you an example of instances in my own family where telemedicine has helped us. Now, we're a large family of doctors and we have access to all the hospitals that we could choose to. A relative of mine had a very advanced form of cancer, and they wanted to get seen by someone in the US at one of the large onco centers over there. And it was impossible. This was in the middle of COVID. No one could travel, and they were stuck here. But in that time, they were able to send all their files. They were able to coordinate with the doctor over there. They were able to get a treatment plan. And the doctors in India were able to take care of it by following through on the consults that were there. For my own self, I would say that it is convenient because think about the effort involved in even going to a hospital these days. You have to get ready, you have to get all your files together, you have to get a car or identify some sort of transportation, you need to fight in traffic, you need to look for parking, you need to register yourself at the hospital, you need to wait in front of the doctor's office, you need to get time in front of the doctor, and the doctor has already seen 50 patients before you, so he has very little time for whatever you have to say. Try and absorb everything that's happening in front, and most patients tend to be quite dazed during all of this. Try and remember everything that's done. Maybe you get a written record, most likely you won't. You go home and try and remember what the prescription looks like, but you can't even read what the doctor's written. And then you go back and give it to a pharmacist, and maybe something good comes out of that. That is inferior across multiple dimensions. Contrast that with a well-planned online consultation for a relatively benign issue. You can record your session. You will get a printed copy of whatever happened during the consultation. You will get a printed receipt that you see on a computer. For basic things, I would say that online consultation is superior in almost every way, but obviously no substitute. If what you have is life-threatening, if you need to be physically examined, if there is a chronic condition that requires you to be in touch with the same doctor multiple times, you will definitely have to go and visit a hospital, get a lot of tests done, meet the doctor. But 8 out of 10 cases aren't like that. 8 out of 10 times, just talking to someone and getting the right advice in a legible way is good enough.
Sure, if I can just add to what
Sure.
Viren said. I second what Viren said. But we are all talking about digital divide, right? Forget healthcare for a minute, and there is a digital divide is a fact in this country. And digital health is heavily dependent on this digital divide being bridged. So unless there is a bridging of this digital divide happening, access to care, even on the digital platform, will not be uniform across the country. I think that's a very, very critical aspect for digital health to be made accessible to the last person in the line.
Okay. So Ragnar, you've raised a hand. You'd like to come in there, please?
Yeah, I think that's a very valid point. It absolutely is. I mean, we observed this even with when the COVID started and kids had to transition to online learning, right? In a lot of developing countries, that was a huge issue, and it actually severely impacted a lot of younger people. So digital divide is real. The good news is that a lot of people actually have mobile phones. Now, and they're not all smartphones. So until we can actually get smartphones into their hands, into everyone's hands, that digital divide or digital platform may not be fully functioning for everyone. But at least I think if we put something like that in place, then people who are still able to provide in-person healthcare will have more bandwidth to provide it to those who need it, versus having everyone relying on in-person healthcare alone. So at least the digital can offset some cases where situation is, like easy to deal with through online interaction and through self-service and through web bots or whatever is in place. While more difficult, challenging cases are people without digital devices, they can get in-person care.
Okay, so what does it do to the industry, Utkarsh, if digital is the way ahead, and if patients are reaching, there is an entire ecosystem that works. Obviously, in terms of some of the places where you carry out your tests, there are some others where you do others. What does that do to the industry when such a change begins to happen? Patients are directly dealing with hospitals and healthcare service providers for their needs.
I think the first thing that will happen is it will change expectations a lot. Traditionally, you would see that patients treat, and patients have always treated doctors at a state above themselves, right? It is always looking up to the doctors. I think with this kind of democratization, with this kind of retailization of healthcare, and with this kind of access to information, patient expectations are going to change significantly. Patients will expect doctors to be available instead of waiting for them. And like Viren mentioned, right? Even if you do a physical appointment, there is this challenge of having to go to the hospital, having to kind of book your appointment, make the payments, wait for the doctor. I think all of that will change when you go on to the digital play. Right? The patient expectation is going to completely change. Patient is going to expect the doctor to be more easily available, more easily accessible. So I think that is one fundamental behavioral change that is going to happen. And I think another important thing is doctors will have to learn how to communicate, right? Because doctors have been used to physical consultations. They have been used to talking to patients face to face. When you interact in a digital environment, your ability to communicate is completely dependent on the words that you talk, right? It's very highly dependent on the way you are able to articulate the patient's problem. You're able to comprehend the patient's problem and therefore provide the treatment. So I think the communication and the doctor's ability to understand the patient and therefore provide the right set of treatment is also something that will need to be thought of, and doctors will need to be trained to be able to accept digital technology.
Okay, my only worry is, Dragna, before I come to you since you've raised the hand, is that it should become somewhat like our work life, where because of being available on a laptop or a mobile phone all the time, you're there like all the time. Somebody's calling you. Dragna, since you've raised your hand, please.
I just wanted to share a story from my experience. So my parents live in Canada. Canada has universal healthcare. So to Dr. Balal's point, I think a system like this is better administered if you do have universal healthcare. There's specific expectations happening in that place. And then even without a digital platform, actually, so my dad was getting consultations from his urologist like every 6 months. And when COVID started, obviously there was no in-person consultation, but there was a phone consultation. So they weren't doing video conferencing. My dad would just basically go and do a lab analysis. He'd collect whatever he needs to collect to give the specimen, and then the doctor would get results and call him with the results, which was really great. My dad thought it was amazing that he didn't have to actually go into the doctor's office and sit there, and it actually didn't utilize any very developed technology. It was just basic telephone, but the process was set up in such a way that it was actually fairly simple to conduct and minimize the contact between the patient and medical system, so that everybody can stay safe.
Okay.
Sorry, just one more comment about translation and languages and doctors' understanding. So what's really nice about these digital tools, you actually have, like, for example, in Google Meet, you have closed caption. So if somebody has a heavy accent, if somebody has maybe even speaks another language, you can actually use Google Translate as a part of the platform to actually better communicate with each other, which in person may be a little challenging because you don't have a live translator sitting next to you. So that's one of the areas where digital technology can really help.
Sure. Dr. Hariprasad, you raise your hands, please.
Yeah, I think it was a very interesting point which came up, and something which I heard recently. It was about the work-life balance in this world, COVID world, and the digital health world. I mean, I was surprised when I actually spoke to the Association of Emergency Physicians in India and the Critical Care Society of India. Almost they could actually gather information about 50 couples being separated during the period because of the misunderstandings or lack of communication or lack of time to be with each other during the COVID period, and because of the stress that they were going through. So I think we don't speak enough about the psychological aspects of either the COVID or the digital health, but I think that is one very, very important aspect which we tend to neglect. But there are some real seniors, some decision makers on the panel, and I'm sure a lot of people are listening to it. I think that is something which is very important, and attention needs to be paid towards that.
Okay. Since we were talking about the public health part of it, Dr. Balal, and then I'll come to you, Mr. Shetty, as well. Dr. Balal, where should India make the change? Because obviously, in terms of the cost of healthcare services currently, where should India make the change so that the cost can go down, the volumes can go up, and that PPP policy, the public-private partnership policy, that, and we can raise the bar on that one as well. And
That's a great question, Ashu. I think our emphasis, as has been mentioned earlier, should be
there are
preventive.
some state is
Yeah. The only way we'll get a bang for the buck is for heavy investment in preventive and primary and public healthcare in our country. And unfortunately, this is going to be the domain of the government because most investments in public health, primary care, and preventive care would be from the government. And this is certainly worth the investment. You can save a lot more lives. To give you an example, if you can just provide sanitization, clean drinking water, then you can save more lives than what Manipal, Apollo, Narayan, and every other hospital chain put together in a year. Millions of people die, millions of kids die because of gastroenteritis because the problem of sanitation and clean drinking water have not been addressed. And that will cost you a minuscule amount compared to the large tertiary quaternary care hospitals that all of us have set up. And I think that's where the emphasis of the government should be. Public health, primary care, preventive health. And secondary care, taluka levels, small cities could again be something for the government and the private sector to look at. And certainly I believe that tertiary and quaternary care, it could be a joint venture between the government and the private. I think it's a lot better to save 1,000 kids with diarrhea rather than one kid with the heart problem.
okay. Okay, now let's talk a little bit about some of the tech aspects for this. And Mr. Shetty, I'd like to come to you and also to Rama for this. What role, if any, do you think? There's a lot of free apps that are available in helping process some information regarding patients. It could be about their data, it could be about some more generic, some very specific. What role should they have in the entire system where we're looking at a tech-driven system?
Just like no man is an island, I don't think any individual company, hospital, person, or even government can create an ecosystem all by themselves. As a hospital, we treat a large number of patients, but we depend a lot on a very large medical education system that provides the doctors and nurses for us to operate. We rely on a massive R&D system sponsored by the governments to provide the drugs and the cutting-edge medical equipment that allow a doctor to be as good as they are. We depend on the roads to get for patients to even reach our hospital. I remember reading somewhere that some of the best ROI for health investment is actually a very good functioning highway system, because it's better to build a road to a good hospital than it is to build hospitals everywhere. Just from a return on perspective, not to say that we should prioritize roads over hospital, just give an example. So in terms of how we should think about partnering with apps, whether they are free, whether they are sponsored by very large companies, whether it's working startups or giant technology companies or other hospitals, as Dr. Hari Prasad said earlier, we have to find a way to work together in all of this. And every technology solution has its place, and every technology solution has its time. When we started out doing telemedicine, we depended a lot on a huge amount of government support because broadband connectivity was terrible. So we used to connect people using VSAT, that was video over the satellite, which required a huge investment on our side as well as from the government, from the Space Research Agency. But ever since broadband came in, it became a lot simpler. We used to depend on tools like Skype, which we don't anymore. It's now evolved to tools like Zoom, and in the future, there'll be something else. Similarly, technology providers used to be these very large enterprise companies that hospitals used to work with, but now a lot of these tools are available open source. All the startups have been able to implement them much better, and we work with them as well. So to the question that you asked about what role do all these different technology providers provide, there are, Google is one of the most important tools for doctors because that is where every patient begins their journey. from the time they start putting their symptoms into where there's no dedicated symptom checker, but you can just guess from a search history what people are most likely to search for. And hospitals need to partner with agencies like Google to figure out. Now, it's not that we will get into the search business or that Google will get into the healthcare business, but together we provide something much stronger. And that is what is better for patients.
Okay. Rama, the same question to you as well. The importance of those free apps as an institution for Portea, as well as, some of the patients, do they prefer that over maybe something that you offer, which you have some insight into?
Sure. So I think the key thing for us to also note is that the app ecosystem is right now a lot more self-governed. So I think there's also a heavy emphasis on the patients to kind of learn from amongst each other, which is the right app, which is a wrong app. I mean, how do you trust a particular app? The very fact that it's free doesn't necessarily mean it's right. However, I think we should link free is just, I think, a way of looking at it. If you can combine the apps with something which I think next couple of years is going to make a significant difference are the devices which are linked to these apps. They could be a wearable, what we're all accustomed to. Also, a lot of the IoT devices, because when they sync up with the apps, all of a sudden you have a ton of data that the doctors and the healthcare workers can use to guide the patient suitably, be it in terms of how your blood sugar is on a daily basis for the last month, when does it spike, when does it fall, what happened around that, how is your BP moving, keeping track of it manually. I'm sure a lot of them tried that, hugely difficult. Link it to an app, link it to a device. All of a sudden, you've got a well-recorded system that doctors can dip into to guide the patient suitably. There's also another angle over here that we at Portea are trying out, a little bit early days for us. It's a concept of a community health person, so to speak. If you can equip them with these devices and they can reach out to some of these remote communities where each person doesn't necessarily have their own app, but they have someone who's carrying an app and these devices, they can help in exploratory checks of those folks. Is somebody showing signs of a BP? Is somebody showing signs of a upcoming blood sugar? Can we intervene much earlier than after it becomes a raging wildfire? Now, when you do this, all of a sudden you have the ability to influence a much larger community out there. Of course, there are challenges we need to work through in terms of network, in terms of technology, getting people accustomed to using that. But while those are, stuff we need to go through, just the fact that you can have someone combine app, combine devices, and work with a larger population can significantly reach out to people who need it at the right time.
Okay, Dragana, you wanted to come in?
Yeah, I mean, those are all interesting points. I think there's a lot of reservation from a lot of people around privacy and how their data is used, who is using it, and for what purpose. I mean, even Google, we own Fitbit. We have a lot of data. We also have a company called DeepMind that's a very big AI company that has just spun off organization that's going to be working with pharmaceutical companies on drug research. But the point is that, again, that whole piece about privacy, security, and trust is really, really important for the ecosystems that you build. Because, again, providing your personal information to just random apps that you don't know where this stuff is going to end up with is going to become a lot less easy for companies to acquire as the population becomes more technology savvy. So having that trusted brand is really key, and working in a trusted infrastructure is really, really important. That's why we find actually a lot of people working with Google, because we do have very well documented protocols and what we do with data and how we treat it and all that. But I just wanted to mention what Dr. Prasad was earlier saying about wellness, because that is so important. Wellness, I think, across the board, everywhere, for any knowledge worker who is on an electronic calendar and using Meet, like for us, Google Meet, that we're using today to conduct their meetings, we have all of a sudden accelerated the process. I mean, today I have about 10 meetings a day. I have 33 hours of calls per week, which is, then you have to think about, when do I get my work done? And I know this because actually my Google Calendar tells me this. So actually we have built into the Google Calendar an ability for people to build in focus time. So our calendar reminds us, it tells us, okay, you have like 33 hours of meetings. Where's your focus time? You don't have focus time. And then it tells us you're having so many one-on-one meetings with these people. You're dealing with so many group calls. And so that intelligence really does put the onus back on me to take charge of my time. So when the medicine transitions into the digital space in a more structured way, there will be an opportunity to really set up appointments in the way that they were set up in real life. So the fact that you're online doesn't mean that your patient has the right to ping you every time they decide to ping you.
Right.
And you have the right to mute your devices, and you have the right to take time off and all that stuff. So there are ways that are, you know, being built into these tools now to address some of those wellness concerns, for sure.
Okay, Dr. Balal, then let's come to the people part of it. How are hospitals and healthcare providers addressing the challenges of getting the people ready for the transformation that's happening at the workplace? Ultimately, as we were just speaking a little while ago, those devices could change the way they work. The kind of information that's available in their hands, that could change the way everyone works.
I have a confession to make here.
Please.
I think the people who adapted the technology the best were the young nurses in our hospital chains. And the people who didn't adapt very well were people like me, older doctors who've been practicing face-to-face physical consults. But when you realize that it is a necessity and this is something you cannot do without, people do change. For instance, I never used to do teleconsults. Now at least half my consults are teleconsults. Occasionally, I take some help of my young fellows, but you can change. And the important thing is technology has to be friendly. You should not really change very much to use the technology. Technology should be easy enough for someone who's not very savvy to start using it without too much of fear or too much of time being spent. It doesn't make sense for me to spend half an hour to see a patient using a teleconsult, whereas 10 minutes to see a patient physically. I think that gap certainly should not exist. And it is a matter of training the right people over a period of time. And many hospital chains, including ours, have also given the liberty to some of the senior doctors to have fellows or assistants who will assist them in the initial phases till they become familiar with the technology. But by and large, if you want to change, you can change. There's nothing that human beings cannot do. It's just a matter of how important you think it is. And I do believe it's important that we change. Without change, you're going to perish.
Yeah, Mr. Shetty, the future, cloud-driven, more technology. I'm sure some of that you're handling. How is that going to change the face of patients who come to you and your hospitals?
Dr. Balal addressed the most important point, which is there is a learning curve. There are doctors for whom this will be a natural behavior, just like there are people who are more comfortable working from home, interacting with their colleagues through Zoom. And there are those that prefer to be in person. There are some doctors whose practice requires them to be physically present. So a lot of medical specialties can't be done online. Like if you're an anesthetist or if you're a radiation oncologist, you have to physically be present. That's simply not an option for you. Similarly, someone else had highlighted the gigantic digital divide that exists in our country. There are haves and there are have-nots, and it doesn't matter how you cut it. The fact is, this will be a very uneven distribution of resources, of spending, of those who will benefit from a digital transformation and those who will fall by the wayside. So you will see over the next 10, 15 years, this very interesting time where there will almost be two tracks of healthcare. One in which organizations that have been able to adopt best-in-class technology, who have the most agile workforce, who are investing the most in technology right now. It may not seem like much today because honestly, we're all just learning as we go, and these are new behaviors for all of us. But eventually, this will become the norm. And when you have these sort of Six Sigma events like a pandemic, a behavior that was once considered fringe, like online shopping, let's say, becomes mainstream. And soon this becomes the only way people know how to interact with the healthcare system. So, in terms of the adoption of the different technologies, uh, it's not just one thing. There is no one superior provider of cloud services versus another. There is no there is no better system for video conferencing. They're all pretty much the same. The biggest differentiator is going to be the mindset of both the clinical leadership as well as the administration of health institutions, not just in private hospitals, but in government, as well as those thinking from a public healthcare perspective. If they don't adopt that flexibility of mindset and open themselves up to experimentation, spending a lot of money, messing up, losing a lot of data, losing a lot of files, having people get angry with you, like that's all part of the learning process. And unfortunately, the stakes are so much higher for medicine. But this is all part of the learning journey. And this is something that I'm happy that we have a lot of buy-in across. I mean, we've not seen anyone directly oppose digitization, but the challenges are we're only 10% of the way through in understanding the full impact of this. Dr. Bharat brought up a very important point, which is doctors can't do digital consults by themselves. You need fellows simply because you need to do a huge amount of work before this. So it's like going for a meeting unprepared otherwise, without anything to speak about. So leads to a very suboptimal utilization. So there's a lot of behavioral change that also needs to be implemented. You need to completely relook at the way the workflows currently exist. And that requires a lot of convincing, and it requires a lot of buy-in from all stakeholders to take this up. But yes, I mean, it is inevitable, I would say, and organizations that don't completely and radically transform the way every single department works will start to realize that the space in which they get to operate in starts becoming smaller and smaller and smaller. Because clearly this is much more convenient, it's much safer, it's much more actionable. It provides a strong foundation for you to build more learning. And these, as healthcare becomes more digital, it just gives us better tools for us to make things safer for patients.
Okay. So Dr. Prasad, then in tomorrow's world, from the network of hospitals, just for the example of Apollo, it even goes to a place like the hospitals are physically present in a place like Ranchi, where I come from, which is a smaller one at that. How will the network or network of hospital look like tomorrow when we look at the physical hospitals and the ones which are more like the facilitation centers or more like teleconsults, or even where it's a small one but connects to a larger hospital?
Yeah, I think what we believe is going to happen is it's going to be a typical hub and spoke model. We're not going to spend the sort of capex we spend in a large hospital in the smaller facilities, and a lot of, but still provide a similar sort of care with the similar quality of care at any of the hubs that we create. So I think a lot of change that digital health is going to bring about is minimizing the capital, creating an asset-light hub and spoke network, which would facilitate access to the people to your system, and at the same time reach out to a larger section of the population, which would have otherwise been very, very difficult. And regarding the change which you were just talking about, it is not about us changing the people, but the people will change us the way they find it right. For example, telemedicine is not new. Teleconsults are not new. They've existed forever. I mean, I remember it at least 20 years ago that we had teleconsults, but they never used to happen because there was a lot of resistance from the doctors, and people never used to push them to do it. But in this pandemic, even the most resistant doctor to using a system has now got onto a tele platform, and a lot of them actually have allocated specific times to do teleconsults. So I think it's going to be people changing the system, the healthcare system also is going to happen, and we would need to make sure that we're delivering to the expectations of the people, we're delivering to the needs of the people, and making it more convenient to the people.
Okay. Okay. Rama, one last point about how tech and the environment for collaboration can change the service delivery of tomorrow.
Great. I just want to add one point before I take on the question. I think adding to what everybody else said, e-commerce today has set the expectation very high amongst the entire audience. What they expect to see from a digital ecosystem. The ecosystem may be for health, maybe for something else, but that expectation is sky high. I mean, how often have we gone to a doctor visit? The doctor has gone on the rounds. We are waiting for 1 hour. I don't think we've ever expressed a concern. We'll wait for an hour, but try doing the same on a digital consult. If the doctor hasn't joined the call in the expected time, there will be the customer will be raising concern over concern to the customer support, saying what happened. This is an example, right? So this means that all of us will need to up our game in terms of the customer experience, because that's going to define where they go to and what they do. I totally agree with Dr. Hari Prasad. The customer will change us rather than we trying to change how they experience from us. I think in terms of collaboration, I suspect we haven't even scratched the surface, to be honest. Right now, if you look at it, we are still multiple silos as healthcare in the healthcare industry itself. There's a lot of overlaps that can come about, right? Be it in terms of the kind of services the patients can take, kind of synergy between, let's say, an e-pharmacy and a medical provider and a home healthcare provider, the kind of consolidation which can also occur down the line. I think we're very far away from that, but technology makes it possible. People are now thinking about that. Earlier, it would be, I need to physically go do something. You can't even think about what's common amongst these things. But right now, I think we also have our digital health mission talking about how data can travel across ecosystems. Standardization. The minute you start getting standardization, that's the first step towards improving collaboration. And I think you started a journey. I mean, definitely, we are in for exciting times.
Okay, so you almost run out of time. Dragana, just a few words to wrap up the discussion, please.
So thank you all for taking your time to speak with us about the future of healthcare in India. I think there are a lot of very interesting points made. I love that most of the discussion was actually about the system and less so about technology. I like to say the technology is easy, the rest is more complex. So we look forward to speaking with you more in the future about how you envision in which way Google can be your partner. And also we are happy to provide you with additional support in the area of design thinking workshops and various other means of bringing innovation to your organization. So appreciate your time and thank you.
Thank you so much. And just before we wrap up, just one last word. And because we all have gone through tough times, I'm just reminded of a few lines I read. This got nothing to do with healthcare. This is all about poetry that I read. To a skylight, I don't know, I read it in school, so it just comes to mind as I speak. And here's how it goes. We look before and after and pine for what is not. Our happiest moments with some pain is fraught. Our sweetest songs are those that tell of saddest thought. So Shelley is what I remember from school. So it just looks kind of time people have gone through. This is what comes to mind. Thank you everyone for being with us on the ED platform. Thanks for taking the time out.
Thank you.
Thank you.
Thank you.